Yeah, you are audible.
Sir, my topic is ANTS, Anesthetist Non-Technical Skills. ANTS is a behavioral marker system for assessing the non-technical skills of anesthetist. Non-technical skills complement technical skills and its deficiency increases the chances of human error. Hence, ANT skill framework is formed. It has 4 categories: situation awareness, decision making, task management, and teamwork. In situation awareness, we gather information, understand the information, and then anticipate. In decision making, we define the problem, we identify the options, evaluate the options, then take decisions, implement the solution, and monitor the solution. In task management, it's planning and preparing, prioritizing, providing and maintaining standards. We follow the guidelines and protocols, identifying and utilizing resources. In teamwork, there should be a leadership which should be using authority and assertiveness. It should take responsibilities and supporting team, assessing the capabilities, supporting others, helping each other with tasks, and encouraging and supporting, coordinating activities with team member, and exchanging information. The bad behaviors example could be failure to undertake appropriate pre-op investigations, failure to use available equipments, attempt to use unfamiliar equipment in emergency situation, and overconfidence or casual attitude to risk. Examples of poor teamwork: incomplete or inadequate handover, poor communication, failure to follow advice from seniors, failure to formulate backup plans and discussion with team members, and lack of clarity in team members. Sir, that's it, sir.
Okay. That is too short an answer for even a short note question. What is your understanding about this topic? What are you consider this non-technical skills of an anesthesiologist? What is your technical skill?
Sir, technical skills like we are doing, sir, spinal anesthesia, general anesthesia, nerve blocks, and all the
Airway
sir,
management, especially your intubation, your epidural, your nerve blocks.
yes, sir.
All these things are called your technical skills. Okay,
Yes, sir.
so
Yes, sir.
somebody may be very good in intubating any difficult case. Somebody may be just learning. Somebody may be average. All this is all technical skills. But non-technical skill is required. Is it required during emergency or during elective also? Whenever in your routine day-to-day work, do you require a non-technical skill or do you require this decision making? I mean, situation awareness, decision making, team management, and teamwork and task management. All these 4 categories. Do you require them day-to-day practice or only during emergency?
Sir, mostly during emergencies, but it should be done in day-to-day practices also,
Practices also.
because emergency can arrive at any time.
Very good.
Unless you do it as a routine, it will not come in an emergency. That's most important.
Now, where did we evaluate all? I mean, emulate all these things in our own practice, or did we copy it from somebody else?
Sir, sir, I copied it.
No, I'm not asking about your copying the answer. This whole anesthetist non-technical skills, what
Yes,
we are
sir.
now talking about, was it originated by the anesthetist or by we copied from somebody, some other profession?
Sir, actually, it was inspired from aviation industry.
That is the
Correct.
first point you have to give in your answer. Okay. So crisis resource management, CRM, was the brainchild of American aviation industry. They only said that why complications happen or why mistakes or errors happen and how to prevent that. with that in idea in mind, they formulated what is called crisis resource management. Is how to manage a crisis when it happens with
Yes.
or without warning. Okay, so
Yes,
how
sir.
to deploy your people, how to recognize first of all that there is a crisis, then how to take a decision, how to manage that crisis, how to allot the responsibility to individuals who are good in managing that, and ultimately what is the result that you get by doing such allotment, and then getting the cooperation and teamwork from all these people resulted in the formation of what is called crisis resource management, which was also called later in our specialty as non-technical skills of the anesthesiologist, or ANTS, anesthetist non-technical skills. The other name for that is also soft skills. Okay?
Yes, sir.
And this soft skills is nothing but a replication or a modification of the crisis resource management by the aviation industry. That introduction you can give in the first place. Then
Yes,
coming
sir.
to each and individual, every day you will be doing it without your being aware that you are doing it. If, for example, how you are in the final year, okay, Vikas?
Yes, sir.
You okay? Last 2 years you have been working in your OTs, right?
Yes, sir.
Okay. When you were in the first year, when you did not know how to induce a patient, how to give general anesthesia, how were you trained to give general anesthesia?
Sir,
Where did you?
I al I always ask my senior to be my side.
Yes.
They,
The first year, whether you like it or not, your senior will be there to guide you, because you are a novice to the profession. So they have to teach you right from how to start an IV line, how to load the drugs, how to pre-oxygenate, how to give the induction agent, what are all the complications you have to expect. Then how you have to hold the laryngoscope, how you pass the laryngoscope into the oral cavity, how you visualize the glottis, how you pass the tube. Everything is taught to you, isn't it? So
yes,
that is
sir.
the training program that you undergo. Is it part of the task management?
Yes, sir.
Yes. So right from your starting the training until you gain some experience, there is a senior to guide you and you are being induced into the task. Okay. After
Yes, sir.
you come to the second year, third year, you start passing on this guidance to your junior PGs, isn't it? So
Yes, sir.
the senior most professor, then the associate professor, then the hierarchy, everybody, they initially take the responsibility of training the junior most person. Then the junior, once he learns, he takes the responsibility of training the junior below him. So this is also part of the non-technical skills. Nobody has to tell you that you have to go. So when you come to the final year, your senior assistant or registrar will say, you go and manage this case, you take this man with you and guide him and ask him to do the case and you supervise. Yeah, that is all part of this. So every day, this sort of management is going on in a routine fashion in our day-to-day practice. But when it comes to an emergency, it is a question of life and death for the patient on the table. You agree or not?
Yes, sir.
Oh, so that is the time when you have to this routine uh, um, training what you have undergone has to be formulated into these four classes of situation awareness, decision making, task management, and teamwork. These four things are being grouped to recall what you have been doing. For example, when you do an elective case, say one case, will you be very worried?
Yes, sir.
Airway is very easily manageable. Alambati grade 1, healthy fellow 25 to 30 years, no comorbidities, very minor surgery, say hernia. So will you be very anxious to do this case or
No,
worried
sir.
about this case?
No, sir.
You will
I
be
won't be.
more relaxed, isn't it? On the
Yes, sir.
contrary, you have an 80-year-old fellow who has ischemic heart disease, hypertension, diabetes, earlier stroke, The same person comes for an inguinal hernia. Will you be as relaxed as doing a 25-year-old person?
No, sir, I'll be very anxious.
You will be very anxious, you will be worried, you will be preparing yourself more. Okay? But
Yes, sir.
if you are trained with these four categories routinely, even during your ASA 1 case, then if supposing there is a problem occurring in ASA 1 case, you can easily manage that case by going through these four steps of situation awareness, decision making, task management, and teamwork. Okay? So you know,
Yes, sir.
you have to ask somebody to load adrenaline immediately if there is an anaphylaxis. Somebody should load the antihistamine. Somebody should get ready with the fluids and pump it if there is a hypotension. Okay. So all these
Yes.
steps have to be done in quick succession when there is a acute emergency. So that will happen only if you follow these four steps of non-technical skills during your routine, which you are doing without being aware of it, will come handy only when you come into a problematic situation. So
Yes.
the description of this theory gives these four major classifications, under which there are 15 other classifications, subdivisions for each one. The first one has got three. The information, understanding the information, all that is subdivisions of each one. But if you routinely go through this in your day-to-day practice, then it becomes easier. That is why they give in the aviation industry what is called the cockpit drill. They routinely, even when they are not flying, they give a mock drill for the pilots to do all these things, and they will give simulation of situations where there is suddenly the fuel is decreasing, suddenly the pressure inside the cabinet is decreasing, or there is a bumpy cloud coming. So all such situations are given, and every 6 months to 1 year, the pilots are made to undergo this sort of drill. But in our specialty, we cannot create a complication in the patient and try to do that. So we are now relying on simulation technologies for us also. Okay. Most of the
Yes, sir.
CMEs or conferences where you go, you would have come across simulation workshop where they recreate the scenarios which you can commonly encounter, like airway difficult management, or anaphylaxis, or sudden hypotension, desaturation, tension pneumothorax. All sorts of cases are enacted in the mannequin, and you are asked to quickly think how to manage them, and that is how your training is given. So this non-technical skill is nothing but the training to manage any unexpected or unanticipated difficulty by routinely training yourself in your day-to-day practice, so that the outcome is ultimately a success with least morbidity and mortality to the patient. Okay, so after
Yes, sir.
mentioning these four and their subdivisions, after giving all these explanations for that why we have to do that, finally you should conclude the answer by saying there are three categories of teachings for this. One is the postgraduate, from the postgraduate days, you must be taught about these skills. That is how to communicate, how to understand and understand the situation, how to make a decision, how to give the task to the responsible people, how to extract cooperation and teamwork from all. All these things should come from the postgraduate training period itself. That is level 1. Level 2, the immediate seniors, are people who are little senior to you, who have passed out and who are working as registrars or senior registrars in the department. They should also learn about this and then try to pass it on to the juniors. Then level 3 is there should be regular instructors who have undergone this sort of training in simulation centers and other things, who will be able to periodically do the mock drills like what you do in the aviation industry, and keep reminding all the anesthesiologists working in the OT about these four stages or four phases of resuscitation or your duties, so that your technical efficiency is augmented by your non-technical skill development. That is the ultimate idea. So if you write all these things, you can write some more on your answer. And what you have given is just the basics, so you have to expand on that to complete your answer. Okay?
Yes, sir. Yes, sir.
Thank you.
Thank you, sir. Any questions from the students?